Welcome to Revital Physical Therapy channel. I am Nav. I am a licensed ortho-pelvic floor physical therapist. I am here trying to make educational videos for some of the common physical conditions I see at my practice. So stay tuned. Now, what can tight pelvic floor muscles feel like? Someone with tight pelvic floor muscles can have pelvic pain, that is pain in the lower abdominal area. They can have pain with sexual intercourse or penetration. They can have urinary frequency or urgency. They can have urinary leakage with coughing, sneezing, physical exertion like running, jumping, etc. It can also cause pain in low back, pain in hip, or pain in SI joint, that is sacroiliac joint. It can also cause constipation, the feeling of incomplete voiding, or needing to strain bladder or bowel. In this video, we will do some exercises to lengthen or stretch our pelvic floor muscles. So we will be doing belly or diaphragmatic breathing with all the exercises to get a good stretch and relaxation in the pelvic floor muscle. So let's start with some exercises. Some of us may need to modify the exercises according to our strength and flexibility. So you can use some yoga blocks, books, boxes, pillows, blankets to provide some support. I would first start exercises in laying down. You can use a small rolled towel under the curvature of your neck for comfort. Now lay down with your knees bent, neck and shoulder relaxed, and start rolling your pelvis like you're tipping a boat from front to back. When you tilt your pelvis or boat towards your feet, it will increase the gap between the yoga mat and your lower back. And when you tilt it towards your head, it should flatten or press your lower back onto the yoga mat. You can do 10 to 20 of these tilts for a warm-up. Next, you bring your knees to your chest and hold this stretch for 20 to 30 seconds. And do belly breathing to relax your pelvic floor muscles in this position. Then slowly bring your legs down. Next, rotate your legs or lower trunk from side to side. Start with small rocking, easy movements to warm up, then slowly increase the range to go all the way down as much as your body allows. You can do 1 to 2 sets of 10 of this exercise. Next stretch is butterfly stretch. You lay down and drop your legs to the side. You will feel stretch in between your thighs. I will again do belly breathing in this position to open, lengthen, and relax my pelvic floor muscles. You can do 5 to 10 deep belly breaths in this position. So to be able to relax pelvic floor muscles, you need to be in a relaxed, pain-free position. If this position is not comfortable, you can put some yoga blocks, stack up books, or other support for your legs. Next exercise is called Happy Baby Pose. This day I had difficulty doing it because of my tight hamstrings, but you can gradually increase the range of your movements over time. As you practice more, it will get more flexible. If your hamstrings, glutes, or back muscles are tight, you will see your head comes off the floor or your sacrum or lower back getting off of the floor. If that happens, you can modify it by adding a blanket or bolster under your lower back or sacrum and a pillow under your head. So you grab your toes or your feet by your arches and pull them up so your lower leg is perpendicular to the ground, and you pull your knees down to the ground as much as possible. Next stretch is gluteus maximum stretch. So you lay down with your leg crossed over your other leg and your knee is facing away from the middle of your body. Now you pull your knee towards your chest and you will feel stretch in your gluteus maximus, that is your butt muscle. You can hold the stretch for 10 to 20 seconds and do 3 to 5 repetitions of this stretch. Then you repeat it on the other leg. Next stretch is hamstring stretch, which I need to focus on because my hamstrings tend to get very tight. To get a good stretch, you lean over and try to bring your nose as close to your knee as possible. You can do 10 to 20 second hold, 3 to 5 repetitions or more. You can also do butterfly stretch in sitting like this. And while you're doing this stretch, you do belly breathing, relax your pelvic floor muscles, lengthen them, feel them getting longer as you breathe in, and feel them contracting as you breathe out. If the stretch is too uncomfortable or difficult to do, you can put yoga blocks, pillows, blankets, or books to support your legs on the side. I would do 5 to 10 belly breathing, diaphragmatic breathing in this position. Next exercise is called cat and camel or cat or cow exercise, in which we arch our back upwards as in camel and downwards as in cat. So camel or cow, cat, camel, cat. So you breathe out with camel or cow and you breathe in with cat. You can do 10 repetitions of cat and camel. Then you go in child pose where you sit with your butt on your heels and you bring your head down onto the mat and stretch your arms out. This pose needs a lot of flexibility, and if you don't have enough flexibility in your glutes, low back, or shoulders, you can rest your forehead on your fists, or you can use yoga blocks, books, or boxes to rest your forehead. And if you have difficulty putting your butt on your heels, you can use another yoga block or other support under your butt. You can adjust the height of the support according to your flexibility and comfort. And I will add belly breathing, diaphragmatic breathing in this position as well. And in this position, I will have more stretch in the back part of my pelvic floor muscles, and actually I will have a good stretch in my lower back as I do a deep belly breathing, which in fact provides a lot of relief and relaxation in lower back muscles. I will do about 5 deep breaths in this position. The next stretch stretches the piriformis muscle on one side, that is the deep butt muscle, and it stretches the hip flexor muscle, that is the muscle in front of the leg or in front of our hip joint. So on one side it is stretching the piriformis muscle, and on the other side it's stretching the hip flexor muscle. With this stretch, if I'm lower to the ground, I feel more stretch on my piriformis side, and if I come up, I feel more stretch on my hip flexor side. I will hold this stretch for 10 to 20 seconds and repeat 3 to 5 stretches, and I will perform this stretch on both sides as well. Next stretch is in deep squat position with your hips externally rotated. This stretch is very beneficial if you have tailbone pain or coccyx pain. And I will do 3 to 5 deep breaths, belly breaths in this position. Now, if you have limited range of motion in your knees or hips, or you have pain there, you can do some adjustments. You can take yoga blocks or some support, and you can sit on it and adjust the height of it according to your comfort. And you can sit and do deep belly breathing in this position. And I will end my stretches and my workout with few seconds of meditation and deep belly breathing. And that is all for this video. Bye.